And so right now it is my pleasure to introduce you to Dr. Daniel Marullo. He's a pediatric psychologist and neuropsychologist at Children's of Alabama. He's a member of the Pediatric Psychology Consultation Service at Children's of Alabama, and as such, he provides psychological consultation to medical subspecialties, including renal transplant. Dr. Marullo completed his doctoral studies in clinical medical psychology at the University of Alabama at Birmingham and interned in clinical psychology at the University of Texas Medical Branch in Galveston, Texas. He completed postdoctoral fellowships in clinical pediatric psychology at Shriners Burns Institute in Galveston, Texas, and pediatric neuropsychology at Sparks Clinics, again at UAB. Dr. Marullo serves on the Ethics Committee at Children's of Alabama, is active in training graduate students and pre-doctoral interns in psychology, is active with the Alabama Psychological Association, including serving as president and as a representative to the American Psychological Association, otherwise known as APA. Remember that, all the format with APA? So, Dr. Marullo, let's give him a hand, please.
Thank you. I should point out that it's no big deal being the past president of the Alabama Psychological Association. It just means I missed the cocktail party and got nominated. That's pretty much how it works with our organization. Probably like you guys, so don't miss those cocktail parties. We are going to talk about depression, but I can't really talk about depression in children without also talking about anxiety and some of the other psychological disorders because there's such a high comorbidity. Before we get into all that, you'll notice I have a co-author, Dr. Nina Reynolds. Dr. Reynolds and I are the two pediatric psychologists who do all that consulting throughout the hospital. So we stay pretty busy. Cindy likes to keep us busy, and they call us all the time. So she cannot be here. She's got two adorable children. There we go. I have no financial interest. I am going to be talking about some products, different measures that you can buy from different companies. I don't work for them. I don't get any money from them. They just happen to be the instruments that I like the best. So if I asked you, and don't raise your hands, but if I asked you, who of you has experienced depression, I would not be surprised if some of you raised your hands. And if I asked you all to tell me what you think of as depression, I think we'd probably have as many different definitions as there are participants. Everybody's got a sense of what depression is, but it's not always what we think it is. So the DSM, the Diagnostic Statistics Manual, the book that we use to diagnose psychological and psychiatric disorders, basically characterizes depressive disorders as a whole as the presence of sad, empty, or irritable mood accompanied by somatic and cognitive changes that significantly affect the individual's capacity to function. Now, that one statement, there's a lot of key points to really tune in on. I mean, think about that. We always think about depression as sadness, right? Gloomy, that kind of thing. And that's certainly true. But oftentimes, it looks like anger and irritability, and the DSM really picks up on that. And particularly for our pediatric population, that's true. Whereas you may not see sadness, you may see anger, and that's significant. Another couple of key points is that depression is physical and cognitive. It's how we think about things, how we perceive the world around us, and certainly the illness itself promotes negative cognitions and so forth, and can perpetuate depression. But it's also physical. You feel it. You feel it in your body. You feel fatigue and all the stuff. And so again, in a pediatric illness population like chronic kidney disease, and our kids come to us and say, like, hey, I don't feel good. My stomach hurts all the time, and my chest hurts all the time, and you guys are going to send them to the lab, as you should, and when they come back negative, that's where we've got to start thinking about some other things. So we had this idea about what depression is, but we're not always really tuning into all the different aspects of this. And one last thing before I move on, because I forgot to do this. We're a small group. If you got any questions as we go along, don't feel like you got to wait to the end. Just raise your hand. Okay? So, the DSM has a number of different depressive disorders that we look at. The one that we always think about mostly when we think about depression is the major depressive disorder. We'll go into that in just a few moments, but there's all these other ones. The substance medication-induced depressive disorder, again with a chronic illness population. Sometimes the medications that kids wind up taking for their illnesses can affect mood. I always think about epileptic medications like Keppra that can really promote irritability, anger, a lot of acting out, that sort of thing. But the ones you're most likely to see in your clinics, well, first, the most major one is going to be the major depressive disorder. And again, that is the disorder that I think we mostly think about when we think about depression, right? It's characterized by a number of different symptoms. First and foremost being that sadness, gloominess, or with children and adolescents, irritability. Always keep that in mind. But there's also a lot of other symptoms that go along with major depression. Cognitive changes, poor concentration. When people are depressed, they don't think as well. So inattention. Disturbances of sleep, appetite, right? Low self-worth, negativity about yourself, gloomy, that sort of thing. Feelings of guilt, social isolation. Sounding familiar? Right? Okay. And certainly preoccupation with death or suicidal thoughts. Okay? So you need 5 to meet criteria for major depressive disorder. But again, thinking about an illness population, how often do we see that? Right? Is it illness or is it a psychological factor? This disruptive mood dysregulation disorder, that's a relatively new diagnostic category. You may see this in your clinics with pediatrics because it's characterized by this persistent anger and irritability and these temper tantrums, okay, that just go on and on and on. They're very difficult to interrupt. So with children, particularly younger children, when we see parents or teachers or even staff complaining about a child and how ill-behaved, is that a word? They're acting out, they're doing this and that, getting into a lot of trouble and all that. We could think of it a lot of ways, but one of the ways I would like for us to start thinking about is there something else going on from a mood standpoint, from a depression standpoint? As I mentioned, we can't really talk about depression without talking about anxiety. Anxiety and depression go hand in hand. There's a high comorbidity between the two. And when you look at the symptoms to diagnose either one, there's actually a lot of overlap. So difficulties, for example, again with irritability and physical symptoms, problems with concentration, all that. So sometimes it's kind of hard to tease out what's what. But you see this quite often. And with anxiety, you get a lot more physical symptoms again. So some of the key elements of those physical symptoms are nausea, vomiting, diarrhea, sounding familiar? Chest pains, headaches, and all that. So again, a psychological phenomena looking very physical. And when you have a chronic illness population, sometimes it can be hard to tease out what's what. Here are the DSM anxiety disorders. Generalized anxiety disorder is pretty much what it sounds like. This is when people are experiencing a lot of anxiety, a lot of worry about everything. These are those little teenagers that are, they're just buzzing all over the place, right? They just, I'm worried about this and I'm worried about that, and my friends don't like me and I worry about that, and I worry about what's happening to mom and dad, and my grades aren't going to be good enough. And they just, you just get anxious I get anxious just kind of talking about it a little bit, actually. It's just like, oh my God. They're just, social anxiety disorder. These are folks that have a lot of anxiety, more in a prescribed kind of a manner. They have a hard time being out in public, that sort of thing. A lot of our kiddos, because of their early experiences, particularly with the congenital kidney diseases, because of early multiple hospitalizations and all that, they have a hard time forming firm attachments and getting that kind of nurturing, not for lack of effort on the parents' part, but just because of circumstances and all that. And so they have a little bit harder time dealing socially sometimes.